there. Um, all right, well, let's just go ahead and get started, and we'll see if the last one joins us. All right, so thanks to all of you for coming to our Thursdays at 7 series of Zoom calls. We've had a lot of really great topics. Tonight's call is about managing stress, anxiety, depression, and all those things, brought to you by our wonderful friends at Novo Nordisk. We appreciate their support and look forward to the conversation tonight. I think everyone knows me, but just in case, I'm Madonna McGuire Smith, and I'm the Executive Director of Pacific Northwest Bleeding Disorders, previously known as Hemophilia Foundation of Oregon. We're delighted you're joining us tonight. You're welcome to keep your video on. Just remember that if you do, you're giving us consent to use that video. If you don't want to show your image, then I suggest you turn your video off. Otherwise, we may share it, and we probably will share it on our website, so others will see it in the future. Also, notice that your name appears in the lower left-hand corner. And just to protect your own privacy, you're welcome to change that name to a nickname or a first name so that someone can't look you up later and Google you and find out where you live if you don't want them to. We also ask that you mute yourself to kind of keep the conversation coming just from our speaker. But you are also welcome to turn on your microphone occasionally and get involved in the conversation. So feel free to unmute yourself and join the call when you have a comment or a question. But you can also write those in the chat box. There's a little box that will appear to the right-hand side of your screen. If you have your screen set up right, if you have any questions, let me know and I can help you do that, change your name, whatever. And from time to time, we're going to share our screen. Actually, for most of it, I think we're going to share our screen. So I'm going to share with you our upcoming Thursdays at 7. So tonight is our friends from Novo. Next week, we're going to do a camp craft. I think it's going to be origami with Pat Torrey. And then we're going to do a great program with Pfizer about looking forward to the future. And then we're going to do a camp preview with our treatment center and a bedtime stories from our treatment center. And our final one of the series is going to be the series called Challenge Accepted by Genentech. So the interesting thing is we've been doing Tuesdays at 2 with our physical therapist for 11 weeks. Every Tuesday. And then this week was our last one because they've gone back to clinic. So we won't be doing our Tuesdays at 2 anymore unless everybody really, really wants it. And then we may come back in September. For those of you who don't have this, in case you don't, there's my new email with PNWBD, but also my old email still works. And that's my contact information so that you can reach me when you need to. And at this time, I want to turn this wonderful presentation over to our friends at Novo Nordisk. So welcome Danielle Durham, and she's going to introduce our speaker for the night.
Thanks, Madonna. Nice to see you all here. Nice to see familiar faces. Hi, Kath. I'm up here in Seattle where it's rainy and stormy, and my brain is all over the place. I want to give a big thanks to Madonna and Michelle at the chapter for letting us host this tonight. I want to give you a little heads up of what we have been doing at Novo while we live through this uncertainty of COVID and everything else that's going on in the world. We have been making sure that in hemophilia and all of the disease states that we take care of, we've been making sure that our medicines are available to everybody, making sure that our supply is adequate and plentiful. In addition, we're providing grants to our chapters and to the national organizations to make sure that they're able to apply that to community members in whatever fashion they might need. And don't forget that we have NovoCare for anyone that's having issues accessing their medicine. If you've lost your job or your insurance, just go to novocare.com. You can find out more information, or you can reach out to me. With that, we're going to be talking about dealing with stress and anxiety tonight, which I'm sure with the uncertainty of the world that many of us feel right now, it is quite relevant. I don't know about y'all, but I moved in the middle of a pandemic, so my stress and anxiety level is about up to here right now. Um, we have Kathy Tiggs tonight, who's speaking for us. She is an adult and pediatric social worker at the University Hospital at the Cleveland Medical Center in Cleveland. And so she's going to be sharing, leading our discussion tonight. Please feel free to speak up. I know she wants this to be a discussion. We wish you could be at a dinner in person eating like Spaghetti Factory or salmon, but instead we're on Zoom and you're eating whatever you're eating at home. So with that, I will hand it over to Kathy.
Good evening, everyone. How are you? Can you hear me? Awesome. Now, I do believe I may have lost my screen, so I might have to get my daughter back in here to get it for me, but thank you for inviting me tonight. I am the social worker at the HTC in Cleveland, Ohio. I have possibly been in your area before. I've traveled all across the country presenting for Novo Nordisk for the past 10 years. And I'm just thankful that I'm able to see you because I miss being in the rooms, I miss the interaction, and I'm just really glad that we could do it through Zoom tonight. So I'm gonna pull up the screens so that we can get started. And I have my technical guru here with me, which is my daughter, showing me how to use her Apple computer. And I'm just gonna test it here. There we go. Okay, she set me up perfectly. So tonight we're gonna talk about anxiety and depression. It's a smaller group tonight, so I really would love for you to interact with me back and forth. I really miss the back and forth interaction. We're usually sitting down for a steak meal about now so that we can talk and, you know, the glasses are clinking and we're having a good time together. But I want to make it as interactive as possible. So anxiety and depression has hit our community pretty hard over the past 10, 15 years. For those of you, I mean, we're all connected, so we know some things that have happened to some folks in our community as a result. And, you know, we've had some critical things happen, but yet and still we've had some learning experiences as well. So if there's something that we're not covering here tonight, just please unmute and just chime in. And I would be really interested to hear what you have to say about it, all right? Let's talk about the prevalence of it first. Can anybody tell me how prevalent do you think it is for us in the hemophilia community for anxiety and depression? And do you hear about it often?
So are you asking for a percentage or are you asking
Not
for?
necessarily a percentage, but maybe, you know, what are we hearing? You know, what's in the grapevine about, you know, people and their coping strategies or inability to cope in our hemophilia
So
community?
I know there have been a lot of suicides in our community. And so I know that there's just been a lot of challenges, not only, you know, dealing with pain, but also dealing with just additional feeling like they need to provide for their family and they're unable to, or I'm just, you know, we've lived in 3 different communities across the United States in bleeding disorders community, and every one of them, there's lots of that kind of feeling of anxiety of not being able to support their family or not being able to get out or not being able to be active or not being able to do the sport they want to do or whatever.
Right. Anybody else?
Hi, this is Scott.
Hi,
One thing that at least the research is starting to show is that this is the first generation of individuals with hemophilia specifically or bleeding disorders that are getting age 60 and above. And there's no medical research on dealing with comorbidities associated with elder people or end of life or older people with hemophilia. Just a quick story to share. I lost an uncle who contracted Legionnaire's disease, and he a severe hemophilia A, also HIV positive for 20 plus years, and there was no medical best practices on how to treat everything that was going on. So that's definitely a cause for a lot of anxiety as we're seeing older generations live longer and just not knowing how to deal with the comorbidity.
That's true. And you know what, Scott, I did a presentation. I don't remember where or when. I was somewhere, and it was an all-male group. And they were talking to me about the fact that they were not taught how to grow into old age. They were told that they weren't going to live past 25 or 30 years old. And so they did not even think about planning for college, planning for their families, planning for long-term careers. And it was a major issue for them. And they said they really struggled as they moved into their 40s to try to figure out, okay, I'm going to live for a little while. What do I do now? So that's a very great point. Thank you. Anyone else?
Yeah, I would think that it's, probably more prevalent in the older population due to joint damage and all that. People with bleeding disorders these days are a lot more covered as far as having ongoing problems. And so I would think that anxiety and depression in the older population would be more prevalent than the younger ones. But I'm sure it's a lot of it in general.
Yes, yes. And I know how many of us have gone to annual meeting, and we've come across in those sessions in annual meeting where people are giving their testimonials and their testimonies. And they're talking about how their marriages have been affected by their depression. And you said it at the beginning of the session about how do I take care of my family? How do I take care of my children? How do I participate in this family unit? And so you are right on the money. You're right on the money. Anyone else?
I think it also is prevalent in the younger generation. My daughter actually struggles with both, and she has a severe bleeding condition. And, nowadays it's, what sports are you involved in? What activities are you involved in? And with her condition, it's so rare that she can't participate in a lot of those activities. And, you're also looked at for your appearance. And so she's in middle school. You got enough pressure there for just being in middle school, but then also to know that you have a bleeding condition, you can't do things that everybody else is doing. You have bruises, you don't look the same sometimes. It really can put a lot of pressure when appearance is everything in this day and age, and what activities you do.
It is. And can I ask, how old is your daughter?
She is 14 years old, and she was diagnosed with displacement anxiety when she was 10 years old.
Okay. And I usually ask this at the top of the presentation, what bleeding disorders are represented here tonight? Who has
severe hemophilia A.
severe A?
With
Okay.
an inhibitor.
We have VWD and hemophilia A in our family because we adopted a boy from China that has hemophilia A.
Okay.
I am hemophilia B.
Okay.
And my daughter is a von Willebrand's 2B.
Okay. And the reason why I ask is because we do know that a lot of attention might go to hemophilia A and B, and then we're just getting smarter about how to represent better the von Willebrand's population. And oh my gosh, what about women? Have we just been ignoring them for most of the time? But thankfully we're getting smarter, and we're able to speak to their pain, their anxiety, their depression, and really real situations that they're going through now that can maybe deepen these feelings that they're having. So what's up on the
Kathy?
screen is just yes.
Can I ask one thing? So in our family, I'm the only one not affected. Everyone else is
Okay.
affected. So for me, though, I felt like I wasn't being a good enough mom. Like there were bruising and all these things were happening. So for me, it was more like I remember when we first went through our diagnosis, and I was just so anxious and depressed. And the story of when my son was diagnosed, he was 2 years old and he was urinating blood, and we ended up in the hospital, and we didn't know what the reason was. We didn't have any family history. We had no idea what this VWD disease was and all this stuff. And so the night we got admitted, this is kind of a funny story, but I mean, it's not when I think about it, but I was under such anxiety that I was twitching from head to toe. I couldn't go to sleep at the hospital. I was just so stressed. And the next morning I had a few minutes when they had him, they were doing some procedure, doing something. I can't remember what they were doing, but they had him. And so I went and I did a Dr. Google search, which was the worst thing you could have done because I diagnosed myself with ALS.
Okay. Okay.
But I'm telling you, it's just like it manifests itself. That anxiety was just so like, I didn't have any of the sickness, but I didn't want my kid to have it. And I didn't know how to protect him. And I felt like I wasn't doing my job.
Right, right. And you know what? We're going to talk about caregiver depression and anxiety as well, because sometimes we're so busy caring and doing and moving and fixing and straightening and then living and working and everything like that. We sometimes forget that there are some things that we have to address as well as caregivers. And do we do a better job? And I know I've got screens here, but if you know me, you know I love the conversation, right? But do we do a better job at addressing caregivers now better than we did in the past? I'm sorry, my hands are going. Do we do a good job at that?
Yeah, I guess so. I think Selena can probably talk to this as much as I can. I think as caregivers, we're often the ones that are like, oh, you don't have the disease, so work really hard to help those that do have, and you feel like you have to step in. I mean, maybe Selena has more, and Michelle too. She's another caregiver.
I almost think sometimes the caregivers are forgotten because we have our daughter who's a severe bleeder, very rare. I mean, there's only 28 cases of her type in the US. And then I'm having to deal with the other 4 children who don't have bleeding conditions, and they can't understand why when they trip and fall, their dad and I are like, oh, just shake it off and move on. And with the bleeder, it's like, are you okay? Do we have any hematomas? And I think by the time it gets down to me as the caregiver, I would say 99% of the time, I don't have any energy left to worry about myself. It's kind of like majority of your energy and strength goes towards your children and your family. And then by the time it gets down to you, it's like, I don't even want to think about myself. I don't even want to talk about myself. I don't want to even, that's just, a lot of times I say to people, that's just a can I don't want to open.
Right. Mm-hmm. And does anyone else have time for you as the caregiver? Because everybody's exhausted, or they've had to change schedules, miss work, those types of things. Are we all just spent and have nothing left? So just like you said, we're not even going to open that can, and we're just going to keep moving. So, and when we're looking at these feelings up here on the screen, that's some of the things that we can recognize pretty easily. But what about those things that we don't see? And Selena, you were saying, you're so busy fixing and doing, by the time the end comes, no one really sees what you went through. And does it manifest itself in any of these symptoms? Or are there symptoms that somebody may never see unless they ask, or unless you determine to share it, right? So worn out, depressed, tired, very nervous. Do we ever feel that? Yes. Do I ever feel that? Yes. I think all of us can say yes to that, right? But when it talks about moderate or extreme anxiety, it just says that 43% of patients experience it, and then some of them are severe or extreme symptoms. And when we're talking about that, how do we differentiate the everyday stuff that we deal with from something that we should be concerned with, something that somebody would dare to put on a chart or collect the data for? Do we know the difference? Is it necessary to know the difference between somebody that's, oh, she's just having a bad day, she'll sleep it off, let's get her some rest. You know, people do different things to address their anxiety and their depression, versus we really need to get that person some help. Can we tell the difference? It's very difficult.
I don't think you can all the time.
Yeah, I don't think we can either. So one thing that's great when it's a small family unit is we know the small changes. Not only do we know the small changes in behavior, but we know how it looks and what it looks like when it's manifesting itself into something a little deeper that needs to be addressed. We have somebody on the line that has severe hemophilia. And what Novo found out is that the more and more pain and the more severe the disease state is, the more we have a prevalence of depression. Why do we think that is? So mild, 40%, moderate, 66%, and severe, 80%. Why does it get worse? As the factor level goes, our depression goes up.
Having to deal with more bleeds and episodes that being out of school and growing up, I missed a whole lot of school and was laid up in bed for weeks on end, and things pile up so it gets hard to deal with.
Yeah, and that's exactly it, Kevin. I think you read my slides, because when it talks about the factors associated with depression, it does talk about the more severe you've got some of these factors: joint deterioration, bleeding episodes, hospital visits, then our depression and our anxiety, it kind of kicks up there. So poor disease state equals higher prevalence of depression and anxiety. And you mentioned missing some days not going well because you've missed some school or something like that. What does joint deterioration look like physically that might cause depression? What are some of the things that manifest themselves when we have joint deterioration?
Lack of mobility and can't do the things you maybe are used to
Right.
doing.
So there's a mental component to it, of course, an emotional component to it, of course, and then you've got the physical manifestation of just having the bleeding disorder itself. And increased bleeding episodes, we know what that does to a family, and we know what that does to a patient. And another factor, poorly managed pain. And I think you touched on this maybe a little bit. In children, when we have poorly managed pain in children, what does that look like for them? You can see here on the slide, it can go from negative emotions to social isolation or somewhere in the middle. Any of that with any of you?
Yeah, I think for kids too, they try and hide those bleeds because they know they're going to be down, and then they're in pain, and then that pain that they just live with to try and hide away from getting the infusions or being limited to the couch or whatnot. So
Right. Right. And that isolation is real, especially by the time they've reached 8, 9, 10 years old. Especially if they're severe, they've had a life of maybe separation. Some of them maybe spend a lot of time in the hospital. Some of them with excessive bleeding, we pull them in and we say, no, you can't participate. And and no, we don't want you to do the normal things that, you know, everybody else is doing. And, you know, so when we're talking about potential for social isolation, that travels not just from when they're young, but it goes into their teenage years and well into adulthood as well, just depending on how bad it was. So when we have depressed children, do we know the age at which we need to start looking at maybe potential for, you know, self-harm? I mean, statistically speaking, that's one of our highest risk groups there when we're talking about teenagers and depression and anxiety.
I would think that that age is getting lower and lower all the time because kids seem to grow up quicker and quicker. So
Yes,
before, like it might have been, you know, high school. Now I think it's well down into middle school and even the upper elementary grades. I think about some of the
yes,
kids that my 12-year-old hangs with, and even some of the issues that he has. You think, wow, you know, even at 11, 12, 13, they're really feeling that already, even before that teenage year.
yes. They are confronted with a lot of things. And I think Selena said, as far as, you know, their visual appearance, and then if they have something going on that other people don't understand as well, that can be really devastating for our young kiddos. Um, when we're talking about factors associated with anxiety, adults with hemophilia who have acute and chronic pain, 30% self-report depression, 25% self-report anxiety. Now, do we think that self-reporting is a little low? Yeah. As a social worker, we're always told if they say that they just drink 3 drinks, add double that, and it's probably close to what it actually really is, right? So I don't know if I would tell anybody if I was depressed. You know, you can be very functional, right? You can come on the Zoom and look normal, and you can go to work and look normal, and you can be productive. But then when you're in your quiet space, you know, nobody knows what goes on in that quiet space, and you can be depressed and have anxiety, and nobody ever really knows it. And that's one of the things that we have to work on a little better as well. So um, functional impairment, we talked about that in daily activities. When you have things that are going on to where you can't walk, or range of motion is limited, up to 80% of people with symptoms of anxiety and approximately 75% of people with depression report functional impairment. So, and that's just common sense. You know, the more and more it affects you physically, the more and more it affects you mentally and emotionally. I have somebody over there disappearing out of the picture. Who is that? How are you doing that? I'm sorry. You're in and out of the picture. Having fun with Zoom. So when we're looking at low self-esteem, we don't even need to look at the screen to talk about how that affects us. That affected me once in my life when I was younger in elementary school, and I didn't have a chronic disorder. And you know, I didn't have a lot of teasing, and I didn't have to go to the doctor all the time and stay on the ward, and I didn't have to infuse factor or anything like that. So I think that's a blanket thing across our nation, low self-esteem. What does it do to us?
Well, it can certainly make people not want to function or um, do things to their ability. Like they just don't have enough confidence. They just don't feel good about themselves, so they don't perform at a level that they could.
Right.
But you know, we have 4 children, and I think, how do I help them with that self-esteem? Like, what little tricks besides, you know, trying to make them feel good about themselves and tell them how fabulous they are and all that kind of stuff?
Right.
They don't want to hear that necessarily from me. So how do you build that easily? Like it's a huge challenge.
It's a very big challenge. Anybody has any ideas?
For me, I always look at the small wins, just the little things that get done every day, build up to increase self-esteem.
Yeah, I was going to say, The small victories are certainly helpful. So, Mom, you telling me that I'm a great person and I can do anything I set my mind to, and it's a fabulous world, that won't help. But if I have my own individual successes, really small successes to where I'm conquering something little by little over years of developing that expectation that I can do something great and I am worthy, that is one thing that can help the most. And the thing is, it's so personal and different. You have 4 children and you'll have to do it 4 different ways for your 4 different children. You'll be tired at the end of the 20 years, but
Oh, I'm totally tired. They're all like 20 down to 12, so I'm like finally getting them to their own. But it's one of those things that just never seems to end. Even the college kid needs that reassurance all the time, and I find that it's easier to do that with the people that work with us. You know, like I can easily help someone feel great because I know exactly what to say to make them feel good. But with my own kids, they don't necessarily want to hear it from me. They want some of that earned reward from external, like teachers or neighbors or friends, or they want to hear. I mean, Mom's going to say it because it's their mom, but they want to earn that from someone else, and it's hard to help them see that all of those little victories are good.
Yes,
that makes.
I think hemophilia camps are a great source of self-esteem. Growing up, going to a camp when I was young, you're surrounded by your peers, and there's medical staff there who can teach you how to self-infuse, which is awesome. That's one of the biggest stepping stones toward independence, that self-care. But yeah, I think that's a great place, because those aren't your parents, they're your peers and your people who've gone through it as well.
right. And we also have to teach our kids that, unfortunately, even if they do well, there are some people that will not acknowledge it. There are some times where no one will acknowledge it at all. And how do we get that thing down on the inside to where the external recognition isn't as critical as the internal feeling that you get when you do something well? And even if you don't do it well, you know that you've done your best. So if you ever get the answer to that question, you can write a book, because we're still trying to figure that out in the community of psychology and psychiatry.
Maybe someday.
Yeah. And the reason why we can't get our hands around it is because it's so personal, and it depends on your life views and your world view and what's happened to you. And it's just so personal to each individual situation. So factors associated with anxiety and depression, lack of and unemployment. No, unemployment doesn't do it, does it? Let's talk about unemployment. People with hemophilia who were unemployed were 6 times more likely to report depressive symptoms than those who were employed. What do we think about that? And what do we think about the fact that millions more Americans now are unemployed against their will? They don't have hemophilia. So, but is unemployment the thing that's the issue, or is it something else connected to the unemployment that affects us differently?
Well, personally, me speaking from experience, I deal with, they classify it seasonal depression. And growing up, it was the taboo word. You never mentioned the word depression. You never mentioned the word anxiety, because people would look at you like you had a disease. Mm-hmm. And I think nowadays that because it's getting talked about more, I would be surprised to see that the percentage of people reporting it maybe goes up, because it's not becoming such a taboo thing. And even in the employment industry, it's becoming better understood, and its debilitating effects that it has on an individual.
People are reporting it more. We have people that are connecting to counseling and support and resources. But in some areas with some folks, in some cultures, it's still a taboo to talk about depression and anxiety because it speaks to something else other than what it really is, you know, strength of character or you know, weaknesses. And, you know, we can go on with that, but there are some cultures that would dare not, you know, and then there's some, you know, men aren't supposed to be depressed, right? You know, so there are a lot of stereotypes and a lot of taboos out there when it comes to depression. And you are right, though. More people are reporting it. More people are getting help. And I just, you know, look for the day when everybody can do it without feeling like they're going to be looked upon as less than or not being able to cope and produce the way the rest of society is. Because I still deal with people that are really hard on themselves because things just aren't going well every now and then. And that's unfortunate. So, you know, we're talking about factors here, and we're talking a decrease in you know, view of oneself, sports and leisure, thoughts about the future. We started the session out about talking about the future. What about our younger generation now? With being able to project future planning and relationships and family, especially sexuality.
And I think now with this whole COVID thing, nobody really knows their future. None of us do. Like, we don't know. I mean, I'm faced every day with decisions about whether to make things go virtual or keep them live, or how far out can we make them virtual. And so just, you know, I think about my sophomore year, or my sophomore age, college age daughter, and I think, you know, in 2 years she's going to be looking for the next step. Is it going to be a job, or is it going to be graduate school or law school, or what's she going to do? It's like, are we going to be back open? Is there going to be a job for those kids getting out of college, or even the ones next year? Like, honestly, you know, you just don't know how quickly things are going to change during this time of COVID. Our future is going to look totally different a year from now.
It is. And since you brought it up, I'm going to say one more thing about that as well. When they say it's going to be a new normal, it will be a new normal. There are businesses that are closing that are not going to be able to open up again. When you think about on a smaller scale, we know that there are some cities that lose a factory. Let's say that they lose a factory in a small town, and once the factory is gone, everything is gone. Things shut down, stores close, restaurants close, things like that. Now, that's on a nationwide scale now. When the factory has moved out, everything is shut down, nobody can put the key in the door anymore, and it may not open up again. So when we're talking about those in our community, what does that look like for us when sometimes we already have issues finding a job, being able to do certain things on the job, being able to keep the job, especially when they find out that we might have a bleeding disorder. I've got a kiddo that was just discharged from the Army. I said, how did you get in the Army anyway? Because they don't take people with hemophilia. But he said he wanted to be military police and he wanted to be normal, right? So they're already having problems getting a job, holding a job, and being able to just feel that normal. Now, what about in our new normal across the country? How do you think we'll fare? How do you think we'll be able to do? Or will they be in the same situation as we have been all this time? You know, not quite sure of employment, not quite sure if we'll be able to find a job and keep a job and get good medical insurance.
Well, I think one of the ways this will be the new normal is everything being virtual. A lot of people have been able to keep working at home and not needing to go into an office or to be on site. And I think a lot of those positions will just stay virtual. I think, and then that ties in with the bleeding disorder community that, if you're having mobility issues or something that's keeping you from being able to leave the house, you could still stay employed. You could still work if it's something where you're just doing it virtually anyway.
Yes, yes. And boy, it feels great to work from home. Am I the only one able to do that? You can be, it's being casual and business at the same time, and you sign on to the Zoom on time, and you've had a great day. And there were some times right behind me is a love seat to where my granddaughter laid and watched television while I was working. And one day, and it was just perfect. So you're right. Some will be able to work in areas where they've never been able to work before because it's virtual, which is an awesome thing for us. And I'm just looking forward to it because it might shift a whole lot of things as well. We're talking about depression and anxiety. How will this new normal affect us in the positive, right? We say that caregivers and siblings are also impacted by this. How will our caregivers and siblings be impacted, especially if some of them are working from home? So taking all of that into consideration, I don't know if anybody can predict how we're going to come out at the other end of this. But just moving to caregivers and SIBs, it talks about among caregivers, 47% have symptoms of anxiety. And Selena, I don't see her, but she was talking about, very anxious. And there was some depression going on, as well as caregivers face their own mental and physical health issues and financial difficulties. And the financial difficulties come why? Sometimes we can't work. Sometimes only one partner can work. It just looks different depending on who you're talking to.
I'm going to ask real quick about that, because right now we're not only caregivers of people with bleeding disorders, we're also teaching them. They've been doing virtual school for several weeks, and it looks like, several months actually, and in the fall we'll be doing it again. So our 12-year-old, working with him in school is just a big challenge with two working parents, both working from home, older siblings, a couple in college, one in high school. Like you're now not just the caregiver of a bleeding disorder situation, you're also the homeschooler. You're teaching. It's like, and Selena, you must have the same challenge. You have all these kids that you're trying to make sure they're getting their classroom studies done every day.
Yeah. I just got our senior barely graduated, and because of the not surety of next year, I'm actually planning on homeschooling the 3 school-aged kids, and so I'm going to be doing 8th, 9th, and 10th grade.
Wow.
And it is a little bit more of a stress and fatigue. And we were talking earlier about we don't know what's going to be out there for them in 2 years. I've actually started telling my kids, let's work on short-term goals, just because we don't know what's going to happen by next year, and so we can at least have that success of the little short-term goals versus being really discouraged about the long-term goal and, oh, this is not going to happen because of COVID-19 or because of other things that are going on.
That makes sense. And when you're talking short-term goals, we're talking what's going to happen the next month, Selena, because in Ohio here, they're talking about 2 days on, 3 days off as far as being in the school classroom. 2 days.
So is Oregon. Mm-hmm.
Yeah. And what does that look like? What does that even look like? And how can you work? How can you work knowing that you're going to have kids at home needing to be productive? And this is going off topic a little bit, but not really, because especially if you have kiddos with a bleeding disorder, and we had a certain way of dealing with that. We could send nursing out, we could, do some infusions in schools and things like that. So what would that look like for anyone? And treatment, and prophy. And, so it goes well beyond just the classroom for us. So I'm glad I don't have little babies anymore. I have granddaughters that I'm thinking about now and what it's going to look like for them. And I just take my hat off to all of you that still have kids in you know, college and in school age that are, you know, coming up to this new year. It's going to be very different, as well as it's going to be different for the HTC providers, because as a social worker, I'm going to be doing more things in the school as well.
Well, and you had asked earlier on the question, how can, you know, financial anxiety, because of our daughter's condition, I was a full-time worker. I was a sales manager at a hotel, and when her bleeding disorder took the aggressive downward turn that it did, my husband and I had to make the decision that I needed to be a stay-at-home mom and be there if at the drop of a hat, or if anything was to happen to her when she was at school or at home, and be able to be there when she's in the hospital and things like that. And so to take a family from a 2-income household down to 1, and knowing the cost, and we all can, you know, relate to the cost of our children's medication and things like that, it just, you know, it puts a huge stress on the person who maybe has to stay home, or even for, like my husband, he is the only income for our house, and they just adjusted our daughter's medication, and it went from $4,000 a dose to $10,000 a dose. And, you know, when he's adding up in his head 40 doses that we have to keep on hand, and they run this much money, and you're not sure if the insurance is going to cover it or not, it really stresses him out as the provider of the family. Of when he looks at a job now, it's not, is this the job I want? It's, will this job provide enough medical needs to meet my one child's medical needs?
Right. And boy, it's a shame that we still have to deal with that. I mean, that's been a forever thing, right? For as far back as I can remember, I've got a 91-year-old patient. This gentleman, he was part of a concentration camp. And he said, you know what, Kathy? He said, never in my life would I have thought that I would be able to just get Factor whenever I wanted it and as much as I wanted. And I said, Mr. K, you know what? It might be going back in the other direction, because now there's some difficulties being created behind accessing Factor again. Now, have we ever had patients to go without it? No. But boy, how many hoops do we have to jump through now for it? And medication. So, and we have insurance companies asking us now, and Selena, this is, you know, hopefully no one has asked you or your husband this, does she still need that medication? Is this a medication that she's going to need? How much longer?
My favorite question is she going to grow out of it?
Oh yeah. That's, yeah.
That I think we all get that one. Is how soon are they going to grow out of this? And
that's right.
And, it is very frustrating, especially when you do talk to the insurances and they say, well, how badly does she need this?
Yes.
Yeah.
Well, let me tell you how badly she needs this, young man, young woman. And, you know, then when you ask, may I speak to someone that knows about this disorder, please? And then they stutter and they say, well, okay, we'll approve it for you. And it should be better now. It should be better. And these symptoms that are on the screen, I'm not going to go over them, but just dealing with the insurance companies can give me these symptoms right here, right?
You should have twitching. Twitching was the thing that I had the most. Twitching.
Yes.
Immediate anger.
Yes.
That's
indeed.
perfect.
Indeed. And, you know, and no one can really, can anyone get you out of that space, that emotional and mental space when you're there? I mean, what can get you out of the restlessness and the insomnia and the sadness? How do we come up out of that place? You know, I've got slides for that as well, but how do we come up out of that place? What do we do?
I know for me, I force myself to call people or reach out to people, even if I don't feel like it, because I go real internal when I'm down. Yeah. And that's helpful, but it's really hard to do.
It's hard to reach out, very hard to reach out. And look at this first bullet point, social interaction. It's easy to write on the slide and it's easy to say, but man, just raising your head up or walking out the door or picking up the phone can be a difficult process. And is it the same for men and women, Scott and Kevin? Is it the same?
Yeah, you know, family and social circles are very important to help improve my mood.
Yeah.
I've found myself doing a lot more zooming with my social groups. Yeah, I'm seeing more of my mom these days than before this whole lockdown. So
Yeah.
yeah.
I've got a girlfriend that invites the rest of us to a Zoom meeting, and we have dinner on Zoom and laugh and talk. And yeah, so it's and that's not a bad thing. It feels good. And see, I'm in the what's the group, the COVID group, at risk, because I'm up in age, right? And that's a wonderful thing to be able to see people that I haven't seen in years on Zoom. So social interaction. Then it says network with your community. Find a way to help yourself. What do we do to help ourselves? Learn to accept our condition. I think possibly we've done that. Have we done that? And we definitely have educated ourselves. I think the hemophilia community is one of the best educated. I can say that because I don't know what's going on in some of the other, with some of the other chronic disorders, but I think we're awesome, right? We get together, we talk a lot, we have educational sessions, we have Novo Nordisk that listens to us and say, hey, they need us to develop this type of a platform and this type of a presentation, and they come up with it. So what are some of the other coping strategies that we have? Like for real coping strategies. These are very polite coping strategies right here. Well, what else do we do?
So I
Lots of
exercise.
chocolate and we exercise.
Yeah, exercise. Yep, I'm with you, Selena. Yep. Exercise is a good one.
Yep.
For me, I just let myself feel whatever it is I'm feeling. I don't fight it. I just accept it, embrace it. And when my body's ready to move on, my body will tell me I'm ready to move on.
Wow, Scott, I love that. But how easy is that to do?
It's not. Usually it's music. You know, I have different music for different moods. When I'm really down deep in it, and then as I'm working my way up, the music changes.
Okay, I can imagine. So we can tell by your music, uh-oh, somebody needs to go watch him. And then when there's other music, it's like, oh, he's fine. Right? Okay.
Sometimes you just need a good cry. Just a really good, let it all out. Kind of talk to a friend and cry on a shoulder, or share your story with somebody. I know they talk about social interaction, but it could just be not really back and forth, more just a shoulder to cry on, and just kind of share your story and let it all out.
Now, tell me some of the things that we don't want to do. Just in case some of us do them, we're going to get them out there. What are some of the things we really don't want to do?
Start throwing things.
Throwing things.
Isolate yourself.
Isolation.
Extra sleep.
Say again.
Extra sleeping.
Extra sleeping. We have extra drinking. We have domestic violence out there. We have a lot of things that are not good for us that some people use to cope. And, we know what that list looks like. We know what that list sounds like. So some of these things, music, exercising, walking, reading, whatever that looks like for you, especially, Scott, when you said, just let it happen and work your way through it. Let's just go through the process. That's an awesome thing. I can't do that because I'm always fighting it. I'm like, I shouldn't feel this way. But that's very good. That's a very good list. And you know what? When we're talking about exercising, we know the best for everyone is swimming, right? And we know what weight gain means, and we know that weight gain happens when we are depressed, because eating is also a coping mechanism that's not very healthy. Okay, so when we're talking about getting help, counseling, medications, do we want medication? Do we want to talk to somebody? Sometimes no. But
Medication is not a bad thing. I think that gets a bad rep too.
what medication?
Medication.
Okay, it does get a bad rep.
I know just personally, sometimes, you know, I do the coping things. I do the eating lots of chocolate, exercising. One of my coping things I do is I become selfish, and I will go out, you know, during the time before COVID, and I would go and pamper myself. I'd go get my nails done. I'd go get a pedicure, go get a haircut, just something for me. But there are times where I'm able to, I've got a great relationship with my doctor where I'm able to go in and I'm like, look, I'm doing the coping, I'm talking with the counselor,
Right.
but it's just not working and I need a little extra help.
Right.
And going on and with the game plan of it being short term, just to kind of help you get out of that pit that you can't get out of and kind of get yourself to a point where those coping techniques help can be a good thing.
Yeah. Is that something that people share a lot? I've got patients that are mixed. I've got some that, you know, don't mind talking about their medications and inability to cope sometimes. And then I have patients that keep it a secret and they don't want anybody to know. And I
In
think,
my social circle, and I think it's kind of typical, and maybe Selena can agree, for like the 30, 40-year-old woman, at least on the West Coast, it's pretty open. I don't know what it's like for Selena, but my friends and I, we talk about it because we feel like the world is just really hard. We're not really made for this world. So having a little bit of help is a good thing. And it's good to hear what works for other people.
awesome.
I think it's mixed. I do have friends that I can talk to about it. And there's other people that I have come into acquaintance with that it's like, if they find out that you're on an antidepressant, it's like, what is wrong with you that you're taking the easy one. I love that one. You're taking the easy way out.
Yeah.
And so, you know, you can get the mix. I have some friends that are totally for it, some that are maybe a little overly dependent on it, and other ones that you are the worst person in the world because you're taking it.
Right. And Danielle, you did say it. It's your circle. It's the people. It's your age group. I remember 20s and 30s. I remember 40s. And close to 60, we don't talk about that very much. And also it depends on the culture of the people that you hang around and what you're used to seeing and what you're used to doing. So either way, I think that whatever is working best and whatever is taking you from one place of not being able to function to being able to participate and engage in your everyday life, I think that's a good thing. As long as, you know, it's not one of those coping strategies that we just talked about that we don't want to do, right? And the drinking of the wine and all of that, you know, that's, oh, look at the puppy. Okay, I'm sorry. There you go. You know, drinking wine and things like that. And nobody's talking about those types of things. So when we're talking about those behaviors that kind of go against what what society is tolerant of, like, you know, domestic violence and hurting other people and things like that, we know the difference in what works and what shouldn't. So counseling and psychological support, we just talked about that. And, you know, some of the strategies that you guys might use, you did also talk about that as well. And so what do you think? Are we going to live? Are we going to be okay in our community regardless of the depression and the anxiety and the low self-esteem and the changing, landscape of the new normal and just all of those things that we're faced with. And we still have to pro-fee, and we still have to talk to the insurance companies about our, $1 million kid medication, easy $1 million a year. That's a lot.
Yeah, we're going to be okay because we have each other. I think
Awesome.
that's the big part of it, is that we have this community. And, we've been doing these Thursdays at 7 calls, and we have successfully had 8, 10, 12, even up to 50 households sometimes on them. And so it makes me feel good. It makes my heart feel good that we're all there for each other.
Right.
That week after week, people are coming on and reaching out, even though they're stuck in their homes or whatever. The topic might apply to them. Oh, my dog. Might apply to them, might not apply to them, but like just Kevin was with us. We made cinnamon rolls a week ago, and it was one of the most fun, engaging experiences we had, and you couldn't come out of that in a bad mood. It was just hilarious. We had this French chef, our physical therapist, one was a French chef. He basically was the arms of a puppet, and all the things that he did, it just made you laugh so hard because he was throwing things and had flour everywhere, and you just couldn't make the cinnamon rolls without cracking up and just having a blast with other people in your community.
The French
Wow,
chef from the
that
Muppets.
sounds
It was good.
Yeah, so it was really the Swedish chef from the Muppets, but
Yeah.
but he was the French chef because he spoke French, and so it was like a lot of laughs.
Yeah.
But I think that's a big part of it, is the humor and the fact that we can relate to each other, and we still have camp. Like we're having virtual camp, and some of the people on this call, their kids are going to be on it, and I think honestly, I really feel like community is what has helped. When we were first diagnosed, we didn't have community, and I was totally depressed and completely anxious about the whole thing, and my kids were real little, and I didn't have anyone I could turn to. And I feel like as the years have progressed, that was 16 years ago, so as time has gone on and the more people I meet, the more I realize I can do this, and I love being able to help other people who are new to it and let them know that they can do it. And I think that's what makes my heart feel good, is our community is there to help each other, and we've all put a hand out to help the other one come along.
Yeah. And 16 years ago, that's not a long time.
Mm-mm.
So, we've come a long way, baby, but we have a long way to go as well. Can we imagine what will look like 20 years from now? With the new medications and the innovative, products that we have and, supports. I'm looking forward to that. I think I'll still be around. So any questions, anyone? It was so good to see you.
I have thoroughly enjoyed this. I love the conversation. I love the participants. We've had a great time. And my dog is obviously having a great time too. He's like barking at all the other campground dogs.
I thank you for the invitation, and got the technical difficulty. My daughter, I'm so thankful for her. I told her that I was gonna, I'm gonna do something for her special since she got me online here. And I thank you. Danielle?
Anyone have anything? Any questions or comments?
I have a comment. Kathy, I just wanted to say thank you for staying up so late and being with us. I know the time change for you. I have family in Ohio. So I just wanted to say thank you for being with us tonight and staying up late.
You are so welcome. You know what I was thinking about? I was thinking about, usually I fly in and I'm so pumped and I'm up and everything that I don't miss a beat. But I've been just kind of lounging around today, and I'm like, I hope I'm woke at 10 o'clock. But it's good. I really appreciate it. Thank you.
Anyone else have anything they want to say?
Yep. Basically, what Scott said. Thank you. Thank you for being a great presentation.
Mm-hmm.
Not a problem. Thank you. I enjoyed you. I wish I was at the campground.
I know. It's still light out here.
Oh, me and my family, I'm sorry, but way too much information maybe, but we're going to go to the campground in about 3 to 4 weeks, and we're going to do zip lining and cave diving. I'm looking forward to that. So
Oh, that's fun. Family time is another way to come out of depression. Good
That's-
family time.
that's right. That's right. So all of you have a great evening. It's probably still sunshine there, so enjoy.
Well, happy 4th of July, everyone. Thank you, everyone, for coming on and joining us. Thank you, Kathy and Danielle and Novo in general for supporting us. I typed it in the chat box, but we did receive COVID support just as an outright grant from Novo to help us keep our doors open as an organization. So thank you very much to Novo for that. We certainly appreciate that. So unless anyone has anything else, we can all go and have a great 4th of July weekend.
That's awesome. Have a great weekend, everybody. Stay safe. Wash your hands.
Thanks.
Thank you,
It's great
Kathy.
to see you all.
Thank you.
Thanks for coming on tonight, and have a good holiday.
You
You
too.
as well.
All right, bye.
All right, good night, everyone.
Kathy. Thank you, Kathy.